In the earlier video, we talked about the physical therapy treatment protocols for jaw pain or TMJ problems. And again, TMJ or TMD, temporal mandibular disorder, symptom-wise is going to relate to headaches up slightly over the ears and into the front of the head, clicking and popping in the jaw, sometimes a complete inability to fully open up and close your mouth. We recapped before from a 2016 study in the Journal of Physical Therapy, Therapeutics, said that 72% of people doing these physical therapies that we're going to talk about in some form or fashion found physical therapy very helpful with their TMJ problems. So this is, to me, is a good place to start. Very conservative, non-invasive, low to no cost involved at all. So we're going to talk right now about the first step, and that's going to be into the strengthening exercises for the jaw. Now, there's a variety of different strengthening exercises we can do, but being that we don't have a lot of complicated machinery at home, we're going to talk about maybe 3 or 4 simple little exercises you can do. These exercises are going to be described as isometric exercises, meaning I don't physically want you moving the jaw in any certain motions, but what we're going to be doing is we're going to be pushing in a certain direction and resisting it with our hands or our thumb. So the first exercise we're going to do is going to be just to simply open the jaw, or attempt to open the jaw against some slight resistance. So I'm going to use my thumb. You can use your fist. And what I'm going to do is I'm going to push my jaw downward. And I'm going to apply that pressure. I'm going to put that downward pressure against my fist for anywhere between 5 and 15 seconds. And I'm going to do that 3 times. Now, I shouldn't hear any popping or clicking. There shouldn't be any pain associated with this. I'm just trying to open my jaw against resistance for about 5 to 15 seconds, 3 times. Now, the next exercise is going to be just somewhat of an opposite of that. I'm going to attempt to close my jaw against resistance, again, between 5 and 15 seconds. And we're going to do this about 3 times again. So instead of using my fist, I can use my thumb or I can use my fist, but I'm pushing my jaw upwards against resistance. So here I go. Now, I did that for 5 seconds. Again, 5 to 15 seconds, we're attempting to close or brux our jaw against the resistance. Not expecting any pain. If there's pain, we detract from this and maybe we move into the other types of treatments we'll talk about later. The next exercise we want is lateral deviation of the jaw. I'm going to be attempting to move my jaw over to the right against resistance. So I could use my fist, I could use my thumb, but I prefer maybe a flat palm. And I'm going to be pushing my jaw. Again, 5 to 15 seconds, not looking for any pain, and we're using our hand to give it a little resistance. Again, 3 times. Pushing this way. 3 times, 5 to 15 seconds each. Shouldn't be a lot of pain associated with this. And these are basically the simplest things we can do as far as exercises go. Now, if any of you guys have been out in physical therapy before, we know that there's more involved in physical therapy than just straight exercise. The other aspect we have for physical therapy for the jaw would include things maybe to mobilize the jaw muscles and the cervical muscles. So to mobilize the jaw muscles, this is pretty easy. It's a goldfish exercise is what they call it. So in this case, for about 5 to 15 times, we're just going to simply So 5 to 15 times, we're simply opening and closing our jaw, kind of like a goldfish does. That's why it's named that. About 5 to 15 times, and we're going to repeat that 3 times, opening and closing the jaw. Other types of therapists might recommend lateral deviation of the jaw. So we're going to be shifting our jaw to the right 5 to 15 times for 3 repetitions, and we're moving it over to the left 5 to 15 times. I'm not certain how I feel about that lateral shifting. Sometimes it's helpful. Oftentimes it can be painful. I'll advise you, if it hurts, just don't do it. Again, in the science and in the literature, there's a little bit of a divide on whether we need to address the neck as well. So we talked earlier about addressing the neck, whether it's through manipulation. For chiropractors, that's going to be called an adjustment. For physical therapists, they'll call it a joint mobilization. So the question is, do we just attack the jaw, or do we attack the neck and the jaw? Well, if any of my patients know me, I like to take the shotgun approach and do as much as we can. So In that realm, we're going to talk about maybe specific exercises you could do for the neck, both to strengthen it and to improve its range of motion. So one of the exercises we might do is very similar to what we did with the jaw, except we're going to be seeing if we could resist lateral flexion of the neck. So I'm going to keep my head nice and straight. I'm going to put my hand against it. I'm going to push my head into it for 5 to 15 seconds. And then I'm going to push 5 to 15 seconds. And then I'm going to come over to the side and I'm going to push forward 5 to 15 seconds. And I'm going to push backwards 5 to 15 seconds. Now, again, these neck and jaw exercises have a high success rate. According to the studies, between a little over 79% of respondents said that these types of exercises combined with manipulations of the jaw and the neck were very helpful in their treatment of their TMJ problems. So again, this is Dr. Ray, and we're talking about TMJ exercises and stretches that you can do to help out your TMJ problems at home. Thank you much.